everyone, I'm Jūratė from Pulsetto. Did you know that there is a wanderer living inside your body right now? The Romans named it vagus nerve, Latin for wandering. Just like a word, vagabond is the longest cranial nerve you have, touching almost every vital organ to keep you alive without ever thinking about it. And lately, the internet is obsessed with it. Everyone claims they can help you hack, tone, or reset this wanderer to cure everything from anxiety to gut issues. But as a health specialist, when I hear word hack, my alarm bells go off. Biology isn't computer code. It's messy and it's complicated. So today we're doing a deep dive into what is vagus nerve stimulation, what actually works based on data, and what is just expensive noise. First, we look at the vagus nerve as an information superhighway. And here's the key secret. It's mostly a one-way street going up. Around 80% of its fibers are sending reports from your body to your brain. When we stimulate the vagus nerve, we're essentially hacking into that reporting line. We send a signal up to the brainstem, specifically a spot called the NTS. This triggers a release of serotonin for mood stabilization and norepinephrine alertness plus GABA for calm. It even signals your spleen to dial down the inflammation. It tells the immune system, calm down, we're safe. We know this power is real because medicine has been using it since the 90s. Surgically implanted VNS devices were the gold standard. Think of it like a pacemaker for the brain. Doctors wrap a wire around the nerve right here in the neck, connected to a battery in the chest. Fun fact, they almost always use the left side of the vagus nerve. Why? Because the right one has a direct line to your heart's natural pacemaker. Stimulate the right side too hard and you might risk severe bradycardia. We want calm, not cardiac arrest. These implants changed the world for disorders like treatment-resistant depression or epilepsy. And recently, they're being used to help stroke victims to relearn how to move faster. It works by physically rewiring the brain over months. But that's brain surgery. What about everyday people? What about those devices you see online that clip onto your ear or sit on your neck? This is where the science gets nuanced. Skepticism is healthy here. A consumer device won't necessarily deliver the same massive signal strength as a surgical implant. However, studies do show that we can access that pathway non-invasively through the skin. We aren't trying to cure depression with consumer devices. We are trying to help improve the symptoms. We can activate that pathway I mentioned earlier with a gentle stimulation. It's similar to the effect you get from the deep, slow breathing, but targeted. It's not magic, it's physiological assist to shift your body from fight or flight to rest and digest mode. That's why we developed Pulsetto. We didn't want just another gadget that vibrates. We wanted a precise tool based on anatomy of the cervical branch in the neck to help people manually signal their bodies that it's time to recover. The vagus nerve isn't just a hype. It's one of the most powerful systems in your human biology. Learning how to work with it rather than against it is the future of health. Thanks for watching. If you want more science on vagus nerve, make sure to subscribe.